Have you ever looked at your health check report and felt worried by words like tumor marker, positive stool blood test, lung nodule, anemia, or suspicious imaging finding? Many people immediately ask, does this mean cancer? The answer is, not necessarily. Most abnormal test results do not automatically mean cancer, but some findings should not be ignored, especially when they appear together with age, symptoms, family history, smoking history, or repeated abnormal results. In this video, we will use AI-assisted analysis and evidence-based medical research to explain 5 types of health check report abnormalities that may be related to cancer screening. AI can help organize medical information, but it cannot replace a licensed doctor. The first finding is elevated tumor markers. Common tumor markers include CEA, CA125, CA19-9, AFP, PSA, CA15-3, and CA27.29. An elevated tumor marker does not automatically mean cancer. These markers can be influenced by inflammation, benign disease, smoking, liver disease, infections, prostate enlargement, ovarian conditions, and digestive problems. The National Cancer Institute explains that tumor markers may help doctors understand certain cancers or monitor treatment, but they are not perfect screening or diagnostic tools for the general population. The American Society of Clinical Oncology has also stated that CEA is not recommended as a screening test for colorectal cancer, and markers such as CA15-3, CA27-29, and CEA are not recommended for breast cancer screening or diagnosis. So, the first rule is simple. Do not panic over one tumor marker result, but do not ignore a repeated or clearly abnormal result either. The second finding is a positive stool blood test. This may appear as FOBT positive, FIT positive, or positive fecal occult blood test. A positive stool blood test does not automatically mean colorectal cancer. It can be caused by hemorrhoids, inflammation, ulcers, polyps, or other digestive conditions. But it is still important. The US Preventive Services Task Force recommends colorectal cancer screening for adults aged 45 to 75. According to the USPSTF 2021 recommendation statement published in JAMA, colorectal cancer screening provides important health benefits in this age group. A positive stool test is not a cancer diagnosis, but it may need follow-up evaluation, often including colonoscopy. The third finding is a lung nodule. Many people discover lung nodules during a chest CT scan. The report may say 3 mm nodule, 6 mm nodule, 8 mm nodule, ground glass nodule, solid nodule, or part solid nodule. A lung nodule is not automatically lung cancer. The important questions are, how large is it? What type is it? Is it growing? Does it have irregular borders? And does the person have risk factors such as smoking history or family history? The National Lung Screening Trial, published in the New England Journal of Medicine in 2011, showed that low-dose CT screening reduced lung cancer mortality in high-risk people compared with chest X-ray. The Nelson Trial, published in the New England Journal of Medicine in 2020, also showed that CT screening reduced lung cancer mortality in high-risk individuals. For incidental lung nodules, the 2017 Fleischner Society guideline is one of the most widely cited references. It considers nodule size, type, and patient risk factors when recommending follow-up. The fourth finding is unexplained iron deficiency anemia. Anemia has many causes, including nutrition, menstruation, inflammation, absorption problems, and kidney disease. But in adults, especially men and postmenopausal women, unexplained iron deficiency anemia should be evaluated carefully. The American Gastroenterological Association published a clinical practice guideline in 2020, recommending gastrointestinal evaluation for many patients with iron deficiency anemia. The British Society of Gastroenterology also emphasizes that iron deficiency anemia in adults requires proper investigation. This does not mean anemia equals cancer. It means unexplained iron deficiency anemia can sometimes be a clue of chronic blood loss from the digestive tract. The fifth finding is suspicious wording in imaging reports. This can include words such as nodule, mass, lesion, wall thickening, enlarged lymph node, irregular border, calcification, abnormal enhancement, or ground glass opacity. These words do not always mean cancer. A nodule may be benign. A lymph node may enlarge because of infection. Wall thickening may be caused by inflammation. But these findings should be interpreted with the full imaging report, medical history, symptoms, risk factors, and professional evaluation. AI can help translate difficult medical terms into plain language. It can help you identify the key details in your report, but AI should not make the final diagnosis. To summarize, 5 health check report findings may deserve attention in cancer screening. Elevated tumor markers, positive stool blood test, lung nodules, unexplained iron deficiency anemia, suspicious imaging findings. The most important message is this: cancer screening is not based on one number, one symptom, or one word in a report. It is based on patterns, risk factors, evidence-based guidelines, and professional medical judgment. AI helps you understand medical information. Doctors help you diagnose and treat disease. Medical disclaimer: this video is for educational purposes only. It is based on publicly available medical research, clinical guidelines, and public health information. It does not provide personal medical diagnosis, treatment, or emergency medical advice. AI-assisted analysis cannot replace a licensed healthcare professional. If you have abnormal test results, persistent symptoms, or concerns about cancer screening, please consult a qualified doctor or healthcare provider. Logo outro.